We've learned that Lisa Marie Presley, the only daughter of rocker Elvis Presley and wife Priscilla, died after experiencing cardiac arrest.
It's a medical condition where the heart suddenly stops beating. News 8's Emily Leonard talked with a local cardiologist about the signs of heart disease in women.
Joining us now is Dr. Laura Franey, a cardiologist with Corewell Health. Thanks for being here.
Absolutely. Thank you for having me.
Well, today we want to talk about women's heart health in light of the sudden death of Lisa Marie Presley, who died of cardiac arrest. Tell us more about cardiac arrest and some of the symptoms.
So cardiac arrest is an event where your heart goes into a dangerous, or what we call malignant rhythm, and can stop beating and perfusing blood through the body. It can be sudden onset, so there may not be any preceding symptoms, or there can be subtle symptoms that might be kind of warning signs that could lead us to be concerned about an upcoming event.
And is this common among women?
I wouldn't say that it's necessarily common, but cardiac disease in women does remain one of the leading causes of mortality in the United States.
Yeah, it is one of the more leading causes of death. Can you talk more about why that might be?
I think as we're learning more about cardiac health in both women and men, the main thing that we focus on is risk factors. And as people are living longer, we tend to develop more risk factors that are potentially causes of cardiac disease in this population. So when I talk about risk factors, things that we all know about: blood pressure, cholesterol, diabetes, tobacco use, and family history is also an important one that we can focus on.
So what can we do to concentrate on those issues to make those risk factors go down?
So I think as a patient, it's important to be proactive, to be your own personal advocate. So I always tell my patients they should know their numbers. So know where their blood pressure is running, what their cholesterol is, make sure they're getting their annual physicals with their primary care physician for diabetic screening. And if they have a strong family history of cardiac disease, that's very important to mention to your physician. So we can talk about ways that we can screen people, even if they might not be having symptoms, and help kind of risk stratify them.
All right, doctor, is there anything else you want to tell us about what we should know about cardiac arrest or heart disease?
So I think especially for women, it's important to know that symptoms might not be those typical symptoms that you think about in someone who has heart disease. So I think a lot of people think that that traditional chest pain when you're exercising is the only thing to look out for. But if you're having any new or unusual symptoms, such as more shortness of breath when you're doing your normal daily activities, or heart racing, or something even as simple as fatigue, that would be just something to bring up with your primary care or physician or cardiologist. It doesn't necessarily mean there's a heart problem that's going on, but it's never wrong to mention new symptoms to your medical team.
Yeah, be your own health advocate. Dr. Laura Franey, thank you for joining us.
You're welcome. Thank you for having me.